very well. Thank you. I met with him, I'm the head of the Secretariat. I'm working for intergovernmental together with partner organizing the high level. Always. Yeah, we're here to support you to make sure that this is going to be a success. Pleasure.
Good. We have the numbers of the little in. Still don't have a chair. He's been homeless yet. Yeah. Yeah, but he went through Europe. How are you? Good to see you. Well, that's why
No, no, no. That's unfair. No. Pleasure.
I call to order the informal interactive multi-stakeholder hearing as part of the preparatory process for the high-level meeting on pandemic prevention, preparedness, and response. This meeting is held in accordance with paragraph 6 of Resolution 79/333 of 5 September 2025. I warmly welcome you all to this meeting. This interactive hearing offers an opportunity for participants to benefit from the perspectives of all stakeholders on urgent actions and investments to strengthen pandemic prevention, preparedness, and response by sharing experiences and best practices and to raise the level of preparedness, including early warning systems. The hearing aims to support member states with the preparatory process, including to inform the negotiations on the declaration of the high-level meeting through an interactive dialogue with communities, civil society, and other key stakeholders. I will now make a statement on behalf of the President of the General Assembly. Your Excellency, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, Your Excellency Joy Fumafi, Co-Chair of the Global Preparedness Monitoring Board, Your Excellency Karoli Martin Ngoga, Permanent Representative of Rwanda, and Your Excellency Pario Hovhannisyan, Permanent Representative of Armenia, co-facilitators of the process. Dr. Werner Obermeyer, Excellencies, distinguished delegates. The recent Ebola outbreak in the Democratic Republic of Congo and the cases of the Andes antivirus aboard a cruise ship have reminded us why pandemic prevention, preparedness, and response matter so deeply. These outbreaks caused widespread public concern while illustrating a wider reality. Emerging and re-emerging pathogens remain a persistent and serious global challenge. Unfortunately, that challenge is growing faster than our investment in preparedness, as reports suggest. Outbreaks are becoming more frequent, more complex, and harder to contain, while the systems designed to manage them are under exponential strain. This is a trajectory we must reverse. Our responses need to be faster, more coordinated, and more equitable. This requires concerted efforts across 3 areas, all of which depend on participation of you, the key stakeholders. First, it is imperative that we promise communities with limited access to surveillance, diagnostics, and countermeasures, because those most exposed to outbreaks are often the least equipped to detect, contain, and respond to them. In this regard, boosting support by civil society groups and regional and local healthcare networks is critical. For we cannot abandon those on the front lines of new outbreaks to manage alone, especially when each local outbreak carries the risk of becoming a wider global threat. Second, it is essential that we strengthen the sharing of data information. These are among the most important tools in pandemic prevention, preparedness, and response. From early detection to rapid response, from data sharing to collaborative surveillance, we must use every tool available to strengthen the global system before the next emergency. Third, our efforts must be globally coordinated. As the COVID-19 pandemic illustrated so starkly, viruses do not respect borders. No country, regardless of its capacity, can contain a pandemic alone. Thus, multilateralism remains our first line of defense. Excellencies, we should welcome recent progress, including the adoption of the World Health Organization Pandemic Agreement in 2025, which reflects a shared commitment to the collective action. The final mile now lies in securing agreement of the Pathogen Access and Benefit Sharing Annex and bringing the agreement into force. This would mark a critical step towards a fairer, more predictable, and more equitable global response architecture. But agreements alone are not enough. Effective pandemic governance depends on empowered and protected healthcare workforces, equitable access to medical countermeasures, interoperable global surveillance systems, and strong community engagement built on trust. Recent outbreaks, including Ebola, have shown what coordinating action can achieve. During the 2024 to 2025 outbreak in the Democratic Republic of the Congo, rapid collaboration among the World Health Organization, national authorities, civil society, and humanitarian partners enabled the deployment of more than 100 experts, the establishment of treatment centers within days, and the vaccination of tens of thousands of people, helping to contain transmission swiftly. This is both multilateralism and multi-stakeholder engagement in action, built on the strength of many actors. Governments bring authority and responsibility. Civil society organizations bring community reach and trust. Academia brings research and evidence. Frontline responders bring practical expertise. The private sector brings innovation, logistics, and scale. As we prepare for the high-level meeting, this kind of multi-stakeholder engagement must remain at the center of our work. Pandemic resilience cannot be delivered by any single actor. It must be built across institutions, sectors, and communities before the next emergency arrives. Excellencies, decades of experience, most notably during the COVID-19 pandemic, have taught us that outbreaks thrive where systems are weak, where inequalities are wide, and where trust is eroded. They have also taught us that preparedness costs far less than crisis response. Investments in surveillance, health workers, diagnostics, vaccines, therapeutics, and community engagement are investments in stability, development, and human security. We therefore have a clear responsibility to sustain political commitment, close gaps that leave communities exposed, and strengthen the multilateral cooperation on which all countries depend. Let these priorities guide us as we move towards this high-level meeting. Future outbreaks will come. Whether they become global crises will depend on the choices we make now. Let us not delude ourselves into thinking that this cannot happen again, nor force ourselves to relearn the hard lessons. Let us instead apply those lessons where they matter most, in saving lives, preventing pandemics, and preparing before they occur. I now invite participants to view a pre-recorded statement by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization.
Excellencies, dear colleagues and friends, greetings from Kampala, where I have spent the past 2 days meeting political leaders, partners, and health workers to support Uganda's response to the current Ebola outbreak. Last week, I was in the Democratic Republic of the Congo, where I traveled to the epicenter of the outbreak in the province of Ituri, the city of Bunia. Last month, I was in Tenerife, supporting the safe disembarkation of passengers and crew from the MV Hondius after the hantavirus outbreak on the ship. In each case, the situation is different and the response is different, but the principles are the same: solidarity, equity, and cooperation. No country can respond to a pandemic alone. Shared threats require a shared response. Strong national systems remain the foundation, but they depend on international solidarity and multilateral cooperation to function effectively. The COVID-19 pandemic killed documented more than 7 million and estimated with excess mortality 20 million people and exposed major weaknesses and inequities in the global system. Since then, WHO has taken concrete steps to improve surveillance, expand equitable access to medical countermeasures, and strengthen pathogen sharing, accountability, emergency workforce capacity, and sustainable financing. Member States have also adopted amendments to the international health regulations and adapted the WHO pandemic agreement. The pathogen access and benefit sharing system, the PABS annex. That's why this year's high-level meeting on pandemic prevention, preparedness, and response is so important. A strong political leadership with concrete commitments and targets is essential. The outbreaks of Ebola and hantavirus remind us that the risk of epidemics and pandemics is a constant threat. The current outbreak of Ebola in DRC is the 17th in the country. Under the leadership of the government, we will end this outbreak, just as we have ended the 16 previous outbreaks. It's just a matter of how quickly we can do it. The true measure of success, however, is what we do to prevent the 18th outbreak or the 19th. We must break the cycle of panic and neglect. We must change the game. Thank you all for your commitment to doing that and to building a healthier, safer, fairer world. I thank you.
I thank the Director General of the World Health Organization. I now invite Her Excellency, Ms. Joy Fumafi, Co-Chair of the Global Preparedness and Monitoring Board and former Minister of Health of Botswana, to make a statement.
Thank you, Madam President. Your Excellency, President of the UNGA, Your Excellencies, co-facilitators, Excellency DG of the WHO, Excellencies PRs of Member States, colleagues and friends. The Global Preparedness Monitoring Board, GPMB, is honored to participate in this event. The GPMB has spent the last 8 years objectively assessing the available evidence and monitoring pandemic preparedness and accountability around the globe. In 2019, just months before COVID-19 emerged, our report warned of the threat posed by a rapidly spreading respiratory pathogen and the consequences of failing to prepare. 3 years ago, we urged leaders to turn the lessons of COVID-19 into sustained political action that remains just as relevant and urgent today, as we have seen in the last few weeks with Ebola and, of course, hantavirus. Today, the world has fundamentally changed. We face greater geopolitical fragmentation, tighter fiscal space, erosion of trust, conflict, climate pressures, and rapid technological change. Preparedness efforts must therefore adapt to this reality. The adoption of the WHO pandemic agreement and the amended international health regulations and the strengthening of the pandemic fund are important milestones, but they are not the end of the process. They are the beginning of implementation. Each DRC Ebola outbreak presents different challenges, but after 17 outbreaks, certain problems should no longer surprise us. Communities are still losing trust. People are still resisting response efforts. Health facilities are still being attacked. This is not the people's fault. It is a collective failure to learn and act on lessons that have been available to us for years, to build trust, to break the cycle of panic and neglect. The lesson is that pandemic preparedness in each sector must evolve. A second high-level meeting only 3 years after the first matters. It reflects both the growing agency of pandemic risk and recognition that progress cannot wait another decade. Governments do not wait for war to begin before investing in defense. They prepare because they understand the cost and consequences of being unprepared. Why do we not apply the same logic to pandemics? Pandemic preparedness is not a competing health priority. It is building national resilience. It protects populations, grows economies, delivers health services, and social stability. Just 3 weeks ago, the GPMB launched its final assessment of global preparedness, a world on the edge. The report presents a stark conclusion. Preparedness efforts are not keeping pace with the rising pandemic risk. It is not a conclusion we reached lightly. Drawing on 10 years of data and lessons from successive public health emergencies, the report identifies 3 priorities that could help guide the political declaration. First, monitoring of pandemic risk is critical. Second, equitable access to medical countermeasures is essential to break the cycle of neglect and panic and to restore trust. Third, sustainable financing for preparedness and response is essential. All 3 build trust, and all 3 depend on sustained political attention and leadership. The single greatest gap in the preparedness architecture is global monitoring of pandemic risk. Not prioritized at the (2023) high-level meeting, risk monitoring must be addressed this time. Leaders urgently require a clear picture of how pandemic risk is evolving and whether preparedness commitments are reducing that risk. The GPMB is concluding its mandate this year. Other COVID-era monitoring processes are also winding down, and no equivalent mechanism is currently positioned to take their place. Without comprehensive monitoring, political leaders, policymakers, and the public risk losing the ability to identify emerging threats, track implementation, and maintain political attention between crises. Such monitoring underpins both themes of this high-level meeting. It can promote accountability for equitable access while strengthening the evidence base for action, investments, and cooperation across governments, sectors, and stakeholders. At the same time, equitable access to medical countermeasures and sustainable financing for preparedness must remain central to the global agenda. Preparedness cannot succeed if life-saving tools remain inaccessible, or if financing appears only after emergencies have begun. It must appear before the emergencies. Ultimately, all 3 priorities depend on sustained political leadership. The central barrier today is not lack of evidence, lack of expertise, or lack of tools. It is the political will to act before crisis forces action. The 2026 high-level meeting therefore presents an opportunity, not simply to reaffirm commitments, but to establish how they will be monitored, how they will be reviewed, and acted upon in the years ahead. The Global Preparedness Monitoring Board's final assessment concludes that the world is on the edge, but it is not without options. the trajectory can still be changed. And this, as this hearing begins, let us build on our collective experience and use this opportunity to chart together how that trajectory is changed through a strong, actionable, and forward-looking political declaration. I thank you, Madam President.
I thank Her Excellency for the statement. I now give the floor to His Excellency Martin Ngoga, Permanent Representative of Rwanda to the United Nations and co-facilitator for the intergovernmental negotiation of the political declaration of the Pandemic Prevention, Preparedness and Response high-level meeting.
Thank you very much, Madam President. Excellencies, distinguished delegates, at the outset, allow me to express my sincere appreciation to you for convening today's interactive multi-stakeholder hearing and for your continued leadership in ensuring that pandemic prevention, preparedness and response remains firmly on the agenda of the General Assembly. I would also like to thank Dr. Tedros as well as Her Excellency Joy for their valuable contributions today. It is an honor to address this hearing in my capacity as a co-facilitator, together with Armenia, of the intergovernmental negotiations on the political declaration for the 2026 high-level meeting on pandemic prevention, preparedness, and response. The strong participation in this hearing reflects the importance attached to this agenda. I thank you all for being here and for underscoring that effective pandemic prevention, preparedness, and response requires a multi-sectoral, whole of government and whole of society effort with the equity at its core. This is one of the enduring lessons of the COVID-19 pandemic. At the same time, ongoing outbreaks, including Ebola and hantavirus, remind us why this discussion remains so urgent and why the process ahead matters. Since our appointment, Ambassador Paruyur and myself have been engaging with the member states, stakeholders, and partners in order to listen carefully and to better understand the perspectives that should inform this process. As co-facilitators, our intention is to conduct a process that is inclusive, transparent, and consultative, one that reflects present realities, recognizes both progress made and gaps that remain, and takes into account existing mechanisms, initiatives, and processes with a view to strengthening and complementing them. Our objective is to help shape a political declaration that is concise, action-oriented, and inclusive, and that can sustain political momentum towards a stronger pandemic prevention, preparedness, and response. In that context, it is also important to underline that this process should provide political support to the broader PPPR agenda without litigating issues that are being addressed in other relevant settings. The value of the high-level meeting will rely in helping reinforce political momentum, support implementation, and strengthen coherence across the wider PPPR landscape. Today's hearing is therefore of particular importance. It offers an opportunity to hear directly from stakeholders on how commitments can translate into stronger capacities in practice, including through stronger national systems, better surveillance, and early warning, sustained investment in the workforce, and financing that supports implementation on the ground. It also offers an opportunity to reflect on preparedness across the full continuum, including prevention and response, as well as on the role of multi-sectoral approaches such as One Health, the resilience of production and supply systems, local and regional manufacturing capacity, and how preparedness efforts can remain anchored in national priorities while supported by effective cooperation and timely resources. In that point, we look forward to hearing your views, your concerns, and your recommendations as work continues ahead. While COVID-19 may now feel like a distant memory, the lessons it left behind remain as urgent as ever. We should not lose sight of what the pandemic revealed, including the costs of unpreparedness, the consequences of inequity, and the importance of solidarity and cooperation. It is our hope that today's discussion will help carry those lessons forward into stronger action and the more effective collective preparedness for the future. As Dr. Tedros has reminded us many times, nobody is safe until everyone is safe. That remains a simple truth that continues to capture both the urgency of this agenda and the responsibility we share. Thank you for your attention.
I thank His Excellency for the statement. As indicated in the program, this interactive multi-stakeholder hearing also consists of 2 panel discussions and a closing segment. The first panel discussion, entitled Multilateralism for Equitable Access, the World Together for Pandemic Prevention, Preparedness and Response, will be moderated by Her Excellency Ms. Matthew Joyini, Distinguished Diplomat in Residence of the UN Foundation and former Permanent Representative of South Africa to the United Nations, and will take place immediately following this segment. The second panel discussion, entitled Whole of Government and Whole of Society Approaches, Predictable and Sustainable Capacities and Financing for Strengthened Pandemic Prevention, Preparedness and Response, will be moderated by Her Excellency Dr. Hanan Al-Khoury, Special Advisor to the Prime Minister of Qatar and former Minister of Health and Vice Chair of the Intergovernmental Working Group on the WHO Pandemic Agreement, and will take place this afternoon from 3 p.m. to 5:30 p.m. The closing segment will take place immediately thereafter, moderated by His Excellency Pore Hovhannisyan, Permanent Representative of Armenia to the United Nations and co-facilitator of the Intergovernmental Negotiation of Political Declaration of the Pandemic Prevention, Preparedness and Response high-level meeting. The opening segment is now concluded. I now invite the moderator and panelists to take their seats on the podium for panel discussion 1. Thank you.
Good morning. Okay, good morning. Good morning. Excellencies, distinguished delegates, it is my honor to be the moderator for the first of the 2 interactive panels today. The framing of this morning's discussion, the first panel, is multilateralism for equitable access, the world together for Pandemic Prevention, Preparedness and Response. And as we've just heard from this morning's inputs, pandemics continue to pose health threats to communities around the world. I think all speakers reminded us using the current outbreak of the risk that is still there. And I had two of them talk about the fact that we need to stop the cycle of panic and neglect, as they call it. Global cooperation is the definitive mechanism to help us coordinate effective international responses to these health crises. And again, as it's being said repeatedly, because pathogens cross borders effortlessly, weaknesses in public health infrastructure of one nation exposes the global population to biological and economic risks. So this makes equity our theme today, equity of access to the whole value chain of PPPR to countermeasure and to finance ever more important. I will also encourage all of us to look through the report that Madam Pumapi spoke about, the one that has just been released 3 weeks ago, and the fact that it has concrete recommendations of what can be considered in the political declaration. Our panel this morning explore the elements in governance that have sought to it did caught my mind the fact that the geopolitics have changed. And they've impacted this field as well, and therefore
the WHO-led process on prevention, preparedness and response should be health coverage and primary care. At the same time, international cooperation should build national and regional capacities while respecting state sovereignty. Furthermore, related crisis have both revealed the importance of vigilance and the timely exchange of information, as well as inter-country coordination. For this reason, multilateralism must now show a fair system to ensure access to pathogens and distribution of benefits. Spain will continue to work constructively to achieve this before May next year. There are flexible proposals
Thank you, Chair, Your Excellencies. Equitable access is an integral component of effective pandemic prevention, preparedness, and response. As demonstrated by the Bundi Bugio scale that no single country or region can do alone. CEPI, the Coalition for Epidemic Preparedness Innovations, embeds equitable access through deep partnerships and networks that enable the right products to be developed
Rani, R-A-N-I. IPPS, you have the floor.
Thank you, Chair, Your Excellencies. The 100 Days mission aims to ensure that within 100 days of identifying a pandemic threat, safe and effective diagnosis the 100 Days mission as the unifying goal for PPPR is therefore essential. It provides a shared framework for countries nations. The current Ebola outbreak shows why this matters. There are no rapid point-of-care tests, limited investigational therapeutics and vaccines, and urgent decisions are needed on allocation, trials, and financing. This is not a failure of science, but of sustained political prioritization. To and benefit from the development and production of tools. Coordinated clinical trials to generate evidence quickly, fairly, and across diverse settings. Shared regulatory manufacturing pathways to enable that will strengthen multilateral cooperation and ensure equitable access. Thank you.
Thank you very much, IPPS. And I'll now give the floor to Rani.
Thank you very much. RANI stands for the Resilience Action Network. Issue that is so critical in order for it to be successful, because it is a political declaration. There are very complicated technical aspects to what we're all talking about here today, but ultimately it's about political will, as so many have said. And while the PABS, pathogen access and benefit sharing negotiations show how hard it actually is to get the technical details right, the incremental changes that we've seen to date haven't been sufficient. So we need commitment to transform this system, not just tinker at the margins, and make sure the pandemic agreement is able to be implemented and the high-level meeting reestablishes the leadership and commitment to this agenda with time-bound action. Thank you very much.
Thank you very much, Rani. And I now give the floor to the Drugs for Neglected Diseases Initiative.
Thank you, Chair, for the opportunity to share the perspective of the Drugs for Neglected Diseases Initiative, or DNDI, an international not-for-profit research and development group. I'll focus my comments on 3 critical points. First, as we are seeing in the DRC and Uganda with the Bundibugyo Ebola emergency and other recent outbreaks, when no treatments, vaccines, or rapid tests are available, starting the research and development process once an outbreak has already been detected leaves communities, caregivers, and clinicians empty-handed. We can only get to the sprint of the race to develop new health tools by running the marathon. Second, the situation is particularly dire for therapeutics, which is why DNDI, along with many other partners in this room, urges member states to commit to supporting and financing a therapeutics development coalition in the political declaration. This coalition will aim to accelerate the discovery of new antivirals for pathogens with pandemic potential so that we have at least 2 phase 2 ready antivirals for every priority viral family before the next outbreak hits. But of course, innovation, R&D alone is not enough. No one in this room needs reminding that during COVID-19, access to the vaccines, treatments, and tests that were developed was profoundly inequitable, and millions of lives were lost needlessly. The question, therefore, is how to ensure public investments in research and development will translate into timely development of accessible health tools that can save lives. Public funding has played and will continue to play a key role. While acknowledging that the pandemic agreement is not yet fully finalized and ratified, countries have a critical window of opportunity now to put in place the necessary guardrails to ensure that public R&D funding delivers public value. This is precisely the intent of Article 9.5 of the pandemic agreement, to link public investments in R&D with conditions that will ensure the development, affordability, availability, transparency, and equitable benefit of medical countermeasures. So finally, countries can and should begin implementing Article 9.5 now as a tangible outcome of years of negotiations and commit to this in the political declaration. It represents a hard-won achievement as well, by the way, as a specific obligation of member states. Implementing it now will ensure that investments in R&D can deliver more equitable outcomes for all. Thank you.
Thank you very much for those inputs. And I now give the floor to the Stop TB partnership, which will be followed by UHC 2030. So Stop TB partnership, you have the floor.
Honorable President of the General Assembly, Excellencies, colleagues, partners, I have the honor to speak on behalf of the Stop TB partnership and the millions of people, communities, civil society organizations, and innovators leading the fight to end TB. Our message today is a simple one. Ending TB is pandemic preparedness. TB is not a disease of the past. It is the world's deadliest infectious disease killer. It is airborne, it is global, and it disproportionately affects the poorest and most vulnerable. Every day, TB reminds us that respiratory pandemics are not hypothetical future threats. They are already with us and many people's lived realities. For many, TB evokes an era of Charlotte Bronte, of Keats, of Nelson Mandela in imprisonment. Yet for millions, especially in high-burden countries, TB remains that reality. COVID-19 reinforced what TB-affected communities have long known. TB systems are pandemic systems. The laboratories, the surveillance systems, contact investigation networks, community organizations, infection prevention measures, and diagnostics that drive the TB response are also essential pillars in pandemic preparedness. Investing in the fight against TB today strengthens our readiness for disease X tomorrow. Yet despite its enormous burden and proven relevance to global health security, TB remains chronically underfunded and underprioritized. This gap weakens not only the national TB responses, but it weakens world's preparedness for future pandemics. We therefore call for a political declaration that sets out clear targets and recognizes TB as a core component of global health security, advances integrated respiratory health systems, ensures equitable access to new TB vaccines, diagnostics, treatment and care, and preventative tools, fully finances research, development and care, and places communities at the center through community-led monitoring, through stigma reduction, and other initiatives, including those that have been pioneered through Challenge Facility for Civil Society. The Stop TB Partnership key asks, developed through our extensive consultation of partners, it complements those asks of the Friends of the HLM and calls to prioritize TB within the Pandemic Preparedness and Response framework, to invest in the resources needed to end TB and accelerate access to innovation and ensure people-centered and accountable leadership. There can be no pandemic preparedness without TB preparedness, and investing to end TB today is the pandemic preparedness of tomorrow. Thank you.
Thank you very much for that input. And I now give the floor to UHC 2030.
Thank you. The Civil Society Engagement Mechanism for UHC 2030 brings together over 1,700 members from more than 130 countries around the world to accelerate progress, sustainable progress on universal health coverage. UHC and global health security are intertwined goals to protect everyone, everywhere, and they are achieved through the same health system. The 2023 Political Declaration, PPPR, recognized the fundamental role of primary health care and UHC in preventing, preparing for, and responding to pandemics. And the 2025 Pandemic Agreement further reinforced this connection by positioning UHC as foundational pillar of PPPR. And now is the time to put these commitments into action. We call on member states to first shift from vertical approaches towards an integrated approach for investments in PPPR and UHC grounded in primary health care. Second, to address barriers to health equity for effective response for health emergencies, including addressing financial hardship and barriers due to discrimination. Third, to recognize social participation and meaningful engagement of communities as a core element of PPPR governance to ensure people-centered health services and build equitable and resilient health systems that respond to the needs of the people and communities. And fourth, to take concrete steps toward addressing gender inequality in the health and care workforce. And in short, the political declaration must ensure that investments in PHC, financial protection, and social participation are recognized as essential foundation of strong, resilient, and pandemic-ready health systems. Thank you.
Thank the representative of UHC 2030 for those remarks. And I now give the floor to the representative of the private sector. Oh, sorry. Before that, I give the floor to the representative of Nigeria.
Thank you very much, Madam Chair. Nigeria wishes to express its sincere appreciation to the President for convening this important discussion, and to the distinguished panelists. Thank you for your insightful presentations and substantive contributions, which have greatly enriched the deliberations on this critical subject, preparatory to the high-level meeting. COVID-19 pandemic exposed profound inequalities in the global health architecture and showed that access to life-saving vaccines, diagnostics, therapeutics, and essential medical supplies were far from equitable. For many developing countries, including those in Africa, and in particular in Nigeria, Delayed access translated into preventable loss of lives, prolonged economic disruption, and setbacks to sustainable development. These experiences underscored a fundamental lesson that no country can confront global health threats alone. Effective pandemic prevention, preparedness, and response require strengthened multilateralism grounded in solidarity, equity, transparency, burden, and responsibility sharing. Nigeria believes that a resilient global health system must ensure equitable and timely access to health technologies for all countries, particularly developing nations. We must strengthen international cooperation in a manner that supports local and regional manufacturing capacities, facilitate technology transfer, promote sustainable financing, and build stronger public health institutions capable of responding rapidly to emerging threats. We also recognize the critical importance of strengthening surveillance systems, early warning mechanisms, research collaboration, and information sharing networks. Investments in health system workforce development and community-based responses are not only national priorities, but global public goods that contribute to collective safety and security. Nigeria is particularly concerned by the recurring outbreaks of Ebola virus disease in Africa, which continue to pose significant risk to national, regional, and global health security. These outbreaks underscore the urgent need for sustained international solidarity and timely support for affected countries and communities. Pandemics are global challenges that require collective action and solidarity, and not isolation. It is imperative that the gains of scientific innovation are harnessed for the common good and made available to all countries on the basis of equity, solidarity, and shared responsibility. The international community must ensure the rapid mobilization of financial, technical, and logistical assistance to contain outbreaks at their sources, prevent cross-border transmission, and support resilient health systems capable of responding effectively to future public health emergencies. A threat to health security anywhere remains a threat to health security everywhere. As we move forward, we must seize this opportunity to build a more just and resilient global health architecture. And Nigeria remains committed to working with all partners to advance multilateral solutions that promote health security, sustainable development, and shared prosperity for all. I thank you.
I thank the representative of Nigeria for those remarks, and I now give the floor to the private sector roundtable on global health security.
Thank you, Chair. I'm honored to speak on behalf of the Private Sector Roundtable on Global Health Security, otherwise known as the PSRT, a coalition of companies committed to strengthening pandemic preparedness, prevention, and response. The PSRT was established over a decade ago during the West Africa Ebola epidemic to strengthen collaboration among governments, businesses, and civil society on global health security. The lessons of Ebola remind us that health security is a shared responsibility and that effective preparedness requires sustained collaboration across sectors, borders, and communities. Significant progress has been made in developing effective vaccines, diagnostics, and therapeutics, yet the current Ebola outbreak is driven by a rare strain for which no proven vaccine or targeted treatment exists. This reality underscores a fundamental lesson that no country can prevent, prepare for, or respond to these threats alone. The success of outbreak response depends on strong international cooperation and coordinated deployment of resources. The private sector has an important role to play here. Manufacturing, logistics, data systems, and supply chain expertise all contribute to strengthening global readiness and response. However, these capabilities can only reach their full potential when they're integrated into a coordinated multilateral framework. Equitable access must extend beyond medical countermeasures to include surveillance, lab capacity, trained health workers, and outbreak response infrastructure. Global health security is only as strong as its weakest link. When countries have the resources and capacity to respond rapidly, the entire world is safer. By fostering meaningful public-private partnerships, we can build a more resilient system that protects all populations from future health threats. The PSRT remains committed to working with partners across sectors and geographies to advance a more effective global preparedness architecture. Thank you.
I thank the representative for PSRT for those remarks, and I now give the floor to the representative of the New Future Foundation, to be followed by the World of Life Christian Fellowship. So, New Future Foundation, you have the floor.
Okay. Oh, thank you. It seems my microphone is on. This is Afro Global Alliance.
Is that the New Future Foundation? It's your turn, yeah.
Thank you. On behalf of the New Future Foundation, which represents the greater than 55 million people worldwide negatively impacted by the transatlantic slave trade, we now request all concerned citizens and member states to adopt the promotion of reparations and reparatory justice as the primary vehicle to resolve long-standing issues related to pandemics and frustrate all attempts to prevent, properly prepare for, or effectively respond to health pandemics. Nations and communities adversely impacted by the transatlantic slave trade require reparatory justice in the form of sovereign debt resolution and reimbursement through the form of public health institutions to develop the capacity of the people themselves and ultimately limit reliance on external parties. Reparations is the primary vehicle for pandemic preparedness, prevention, and response, and resolves all apparent conflicts related to equity and the ability for communities to have a voice in their clinical care. We ask you all today on behalf of the New Future Foundation to support all efforts to provide reparations to those adversely impacted by the transatlantic slave trade. With that, thank you.
I thank the representative of the New Future Foundation for those remarks, and I now give the floor to the World of Life Christian Fellowship.
No, wrong mic.
Just to repeat, the floor is given to the World of Life Christian Fellowship.
Madam President, distinguished delegates, colleagues, and partners, we gather at this critical juncture where architecture of our multilateral system is being tested. True global security is not merely the absence of conflict or disease. It is the presence of equitable access to the tools of survival. To achieve genuine sustainability, we must shift from a mobile reactive charity to one of perspective of systemic solidarity. The need for evolution of international law is for sustainability has historically served as a floor, not a ceiling. While instruments like the international health regulations have provided a baseline, their application has been fragmented by national silos. Moving forward, we must view international law not as an abstraction, but as a dynamic mechanism that mandates change. The need for strengthening frameworks and institutional mechanisms to achieve a measurable global impact We must move beyond rhetoric, comments, and addressing the institutional mechanisms for our partnerships. Colleagues, sustainability is the natural byproduct of equity. If we secure the health and sustainability of the most vulnerable among us, we secure the collective architecture of the world. Let us use this PPR process to move forward a system of fragile coordination to one of resilient, equitable, and legally grounded collaboration. The mechanisms of the past were built for a different era. Our task today is to ensure and engineer a system that is inclusive by design and sustainability by commitment. Thank you.
Thank you very much for those input. And I now give the floor to the International Association of Applied Psychology.
I wear many hats here over the 25 years I've been in here at the UN, but I'm speaking now as a representative of the International Association of Applied Psychology, and that word applied is very relevant here for this discussion, because I'm going to share about 2 interventions on the ground, in the field, addressing the issue of pandemics. One is the work that we did in the DRC in a remote village of Nyabibwe, which is south of Goma, with 2 teams. The medical team taught the community, people of all ages, about hand washing and mask wearing. These are people in a remote community. This is a lesson that we have to learn about how to reach those people. The second team was a psychosocial team, and it is essential to address psychosocial issues and support at the same time immediately. My friends from WHO know this. This is in the political declaration of the UHC about how important mental health is. It's in so many, in the agenda as well, in the Global Compact on Migration and the Digital Compact and the Pact for the Future. So the psychosocial team had to use certain techniques like creating a poster with pictures about how to deal with your stress, about breathing techniques, about singing, about ways to connect with children. All of these techniques are very important and lessons learned. The second is when I went to Sierra Leone to communities during Ebola. Not way after, but when everybody was running away, we have to support professionals who are going there. And what do those professionals do? We have to train in a cascading way the community workers so they continue the work, because we have capacity problems. And we have to have people to do simple things to help the communities heal, which is what we did. Lots of activities and training volunteers from the community, even people who were working in the restaurants or who were teaching kids sports, so that we can engage the community in that way. Now, there are lots of lessons that actually I've documented in this huge book about the psychosocial aspects of a deadly disorder and what Ebola has taught us by all the people, many people who were there at the time and did these interventions, including a chapter by Nigeria we heard from earlier. What did they do? They used social media to immediately get the message out. Because even as an academician and as a media person and a journalist, it is essential that we deal with public education. Social media is important, posters, all using sports stars, all these techniques that were very effective that we've documented here. The use of technology, which is exactly what we're talking about a lot at the UN here, creating hotlines. This public education is important to diminish the stigma that people feel. So to wrap up, there's so many ways of community engagement that is important for these kinds of communities. We have to use the local chiefs, the traditional leaders, the survivors who are important, protect the health workers, and also the diaspora. So one last point, and that is that we coined the word Ebolanomics so that we can really press the point about the importance of funding. Thank you very much.
Thank you to the representative of the International Association of Applied Psychology. And I now give the floor to the Dopasi Foundation.
Thank you, Chair. I thank the President of the General Assembly and the co-facilitators for convening this important meeting. I speak today as a Global Civil Society South representative of the Pandemic Fund Governing Board and the Stop TB Partnership. I align myself with the key asks of the Friends of the PPPR high-level meeting. The world does not lack commitments, it lacks delivery. For communities, equitable access is not abstract principles. It is whether a laboratory can confirm a threat in time. It is whether community health workers were trained before the panic struck. It is whether the countries have finances before the crisis struck. That is why Pandemic Fund matters. This is what one of the clearest mechanisms and examples to build preparedness capacities before the crisis, strengthen surveillance, laboratories, health workers, and community engagement. The recent Ebola emergency proved the value of the fund and the speed the Pandemic Fund is already making them real through catalytic funding, not replacing the domestic investment, but unlocking it, aligning it with partners around national priorities and supporting countries to invest in their own preparedness. But demand has far exceeded the available resources. Countries are ready, communities are mobilized. The missing piece is sustained, predictable financing. We must also recognize that pandemic preparedness cannot be separated from the existing infectious disease systems. TB is the world's deadliest infectious disease. The TB platforms, be it laboratories, molecular diagnostics, surveillance system, community networks, and supply chains, they were repurposed during the COVID pandemic and will be essential for any future respiratory threat. So our message is simple. Equitable access must mean access to capabilities, not just commodities. The 2026 political declaration must support a fully resourced pandemic fund, the implementation of pandemic agreement, the amended IHR, operationalize One Health, and recognize TB and respiratory disease systems as core pandemic preparedness infrastructure. Preparedness cannot remain a promise made after every crisis. It needs to be funded, measured, and protected global public good. Thank you.
Thank you very much for that input. And I now give the floor to the representative of SAFE Campaign.
Distinguished delegates, ladies and gentlemen, Assalamu alaikum, peace be unto you. I'm going to try to go as fast as I can, so it's under 2 minutes. Thank you for your time. As president and founder of the SAFE Campaign NGO and a World Peace Ambassador, I stand before you with a simple conviction. Humanity deserves leadership that listens before it leads. Sorry about that. At the SAFE Campaign, we are committed to inclusive meritocracy. We believe the best solutions emerge when opportunities are based upon competence, integrity, lived experience, and service. No privileges or favoritism or exclusion. Every nation, every community, and every individual possesses talent that can contribute to solving our shared global challenges. Our humanitarian philosophy is equally simple. Do not assume we understand the struggles of people from the comfort of conference rooms. We go into the trenches. We walk alongside those who are hungry, displaced, marginalized, forgotten, and unheard. True humanitarian leadership requires proximity to suffering and a willingness to learn directly from those we seek to serve. Today, Many people around the world have lost confidence in international institutions, whether justified or not. That loss of trust is real. Trust cannot be demanded. It must be earned through transparency, accountability, ethical leadership, and measurable action. I remain hopeful. I believe the United Nations remains one of humanity's greatest ideas, a forum, a forum where nations can work together in pursuit of peace, dignity, justice, and human development. While every institution faces challenges, we must not abandon these ideals. Instead, we must strengthen them. The SAFE campaign stands ready to help restore confidence in multilateral cooperation by championing the principles that inspire the United Nations from the beginning: service over self-interest, people over politics, and humanity over division. The future will not be built by a select few. It will be built by all of us, working together with courage, compassion, and a shared commitment to human dignity. This is why I'm confirmed that I'd make an excellent World Secretary General. I've been told that by UN, because I believe I speak direct about what we need for real. You know, the bottom line is there is division in the United Nations. You got to take care of home first. You get the house built right, then you can help everybody else outside. There is a amount of people who see themselves better than those who are suffering. We got to come up off of that thinking. So when I created SAFE Campaign, I went in the trenches because I wanted to hear what the people needed, not what my assumption was that they needed, my opinion. So when it came to the COVID pandemic, I was in a hospital bed with tubes running through my body. The UN called me and asked me for a statement. And I explained to them that I had it verified already by our military policing that COVID really did happen in China, and there is a bad infection there. I gave them my honest opinion, and that's how we got to the mass. That's how we got a lot of people to live, even though some didn't make it, unfortunately. I thank you all for your time and for receiving me today. I've never been invited, and I appreciate it. May you be blessed for it.
I thank the representative of SAFE Campaign for that statement. And I now give the floor to the representative of the U.S. Council for International Business. And that will be our last speaker.
Thank you. The United States Council for International Business, USCIB, is grateful for the opportunity to contribute to this important discussion and reaffirm our commitment to advance efforts in pandemic prevention, preparedness, and response. USCIB is a nonpartisan, nonprofit U.S. business group representing over 300 member companies across all sectors and serves as the voice of American business throughout international organizations, including in the UN, ILO, and OECD. Given the scale and complexity of pandemics, sustained collaboration between the public and private sector is essential to deliver comprehensive and durable solutions. Throughout the COVID-19 pandemic, the private sector responded with urgency to develop and deliver diagnostics, vaccines, and therapeutics, and implemented access solutions to ensure patients could obtain essential products when and where needed. In parallel, industry-scaled manufacturing at risk maintained resilient supply chains and expanded access to self-care products and trusted health information when formal care was disrupted. Collectively, these efforts sustained continuity of care and strengthened the pandemic response. As we prepare for the high-level meeting, we ask member states to remember that the business community plays an indispensable role in the success of PPPR, and we encourage the following priorities. Preserve an enabling environment for innovation and access by promoting legal certainty, regulatory coherence, R&D incentives, IP protections, and systems that support investment and equitable access. strengthen public-private collaboration as a core pillar of PPPR by reinforcing complementary roles with governments, industry, academia, and international organizations to foster innovation, scale manufacturing, strengthen supply chains, and support effective response networks. And finally, integrate NCD management into pandemic planning to better protect vulnerable populations and promote national preparedness plans that maintain continuity of care and invest in self-care and health literacy to strengthen health systems overall. USCIB stands ready to deepen collaboration with partners across sectors to mobilize resources, enhance future response capacity, and deliver meaningful progress to strengthen global prevention, preparedness, and response. Thank you.
I thank the representative of the U.S. Council for International Business for those inputs. Unfortunately, we are not able to take more inputs. However, we do have the names of those of you who couldn't speak but had raised your hand for interventions. So what we will do in the afternoon in the second panel, you will be prioritized should you wish to speak in the afternoon. So do press again, and because we have your details, you'll be prioritized to make interventions. And I would imagine, Werner, that those interventions can also relate to this panel as well. So you'll have an opportunity to do that. So I will stop taking your input so that we can give our panelists an opportunity to respond. But thank you for those rich inputs. I thought it was great that, we heard from member states, we heard from different sectors. And I was particularly struck by one or two or three things that were said. I think the representative of Gavi, who said all of this, how we respond must be driven by the needs of the public health needs as opposed to the purchasing power. And I think it's so important. And also Rani reminded us that, as we could hear from in the room, that this is, yes, technically it's complex, but politically even more complex. When you had the positioning of different groupings of member states, you realize that it's going to be, we'll have to hear each other out. And I'm particularly partial to the TB group because this is one of those oldest disease that still hasn't received the attention that I believe it deserves. And I was very pleased to hear the representative of the private sector, PSRT, vouching for multilateralism. Really? Yes, so that's great. And multilateral framework, as you said, and the public partnership, public-private partnerships. And yeah, somebody said listens before you lead. I think it was the representative of the SAFE campaign. So those were rich inputs. I didn't hear questions, but maybe there were. But you had, we had what member states are doing, good examples. We had reinforcing messages from what we've had in the morning. And then we had specific inputs relating to where you are coming from. So there you are. I really found useful inputs from the panels and from all of you. So I'm going to ask panel members to respond, to say their last word on this. And I'll start with you, Alessandro. Over to you.
Thank you. I learned a lot. I'm gonna just say, focus on a couple of 3 points. One is what a fresh reminder this discussion was of the importance of the interaction between parliaments and civil society, the private sector, the scientific community. The multi-stakeholder approach is, in fact, the key to this issue. And it is what we recommend to our own member parliaments everywhere, to hold hearings with civil society and other groups, precisely because you are the voice from the ground up, And dare I also say that while pandemics are global, they always start local, and you are also the first warning system sometimes of what goes on in communities, let alone you also have the expertise, the hands-on expertise to share with within the public domain. Another caution, I'm also reminded by from this discussion that the healthcare sector is also a terrain of where interest can be at odds with the public interest. So we need to be vigilant that the solutions that are proposed are truly in the public interest. Second, a reminder, something that we haven't really touched upon very much is the importance of the quasi-governmental agencies and regulatory bodies that intervene in this issue, as well as lots of other issues in public policy, and how these agencies need to preserve their autonomy, and they need to be well funded in order to also provide the oversight that we need to make sure that commitments are maintained. And lastly, many of you underscored the importance of UHC, the Universal Health Coverage, which is also where we come from at the IPU. We have a committee, a parliamentary committee on health that's very much focused on universal health coverage as the bedrock foundation for all of these, for pandemic prevention and also other TB, all kinds of issues. To put it most simply, exclusion is a risk factor, maybe the most important risk factor when it comes to pandemics. And so we need to strengthen universal health coverage everywhere so that we have that fundamental safety net that protects everybody. Thank you.
Thank you, Alejandro. Exclusion is a risk factor. Tirana, what did you make of what you've heard? What are your last thoughts?
Thank you so much. I was very encouraged to hear such important themes come out that are very consistent with, I think, what Médecins Sans Frontières sees on the ground. You know, I heard many people reflecting on the importance of accessibility, how critical equity is. You know, I think I spoke earlier and I heard others talking about the need for trust and transparency and partnership. And ultimately I had this underlying message of, you know, who gets a seat at the table and how important it is for multiple stakeholders to be there. And most importantly, the communities that are affected, not only that they have a seat at the table, but they are heard and they are able to shape the responses and the decisions that are taken. And I think that the last thing I would heard is there is a lot of, and I appreciate the interventions from member states. And as I see a level of agreement and commitment that it continues to emerge, I'm reminded of one important thing, and that is that whether it be a framework or a declaration or agreement that we come up with or that we have come up with in the past that will begin to correct the errors of the past, the most beautifully worded frameworks that contains all of our aspirations is one thing, but it will succeed and it will fail based on political will. And I encourage everybody in this room to ensure that whatever steps come next, that whatever frameworks that we develop, that they are enforceable and ultimately that they serve the communities that we are all committed to serving.
Thank you very much for those observations, Tirana. Now, Lydia, your thoughts?
Thank you very much, and thank you for those comments, which were really very, very interesting. What I picked up from this is relating to the topic of today's discussion, multilateralism for access, is that it really needs to be inclusive, effective, and networked. And what does that mean in terms of what we've been talking about? And I would deconstruct this into 4 elements. One would be looking at the science and the research, and we've heard a lot of that today, why the science and the research needs to be more transdisciplinary, needs to be more multi-stakeholder orientated, but also with a focus on neglected and forgotten diseases, because those have a habit of coming back to haunt us, but also to the fact that there's a lot of vulnerability there, which is not being attended to. We also heard about the importance of behavioral sciences and the need to bring this into this kind of thinking, and the importance of public funding for research. I think Tirana made a very important point right in the beginning on the importance of recognizing that public funding needs to be also for public use. When it comes to the governance issues, one of the aspects that doesn't get sufficiently attended to is the importance of collaborative governance. We see a lot of initiatives, we've heard of a lot of work that is going on, but how do we bring these together, and how do we come up with participatory processes where everyone can speak to each other across these initiatives, and whether these initiatives at the global or whether they're the national or the local level. The more we connect the dots, the more we bring these kind of a participation thinking into this, the better we would be for both the preparedness as well as the responses. And that goes for coordination. And it's really good that we have the quadripartite for the UN agencies for the One Health approach, but you can do better coordination even elsewhere in connecting all the different initiatives that we heard. How do we make sure that we scale these up and we take this to the next level? Because otherwise each of these are doing little bits, but you do not get that sufficient attention and the sharing of experiences, except the once in a moment when you come here for some kind of sharing of experiences. This needs to be scaled up much more. And finally, we heard of implementation and the importance of moving from commitments to actions. And the Lyon One Health Summit really had some very clear 5 action deliverables, which were in order to increase these kind of implementations at the country level. And I think we need to move there now to be able to take these forward. I'll stop there, Chair. Thank you.
Thank you for those insights, Lygia. And I now move to the last but not least, Ambassador Clay, your thoughts from what you've heard this morning?
Thank you, Ambassador. And I would like to start by thanking the panelists, the member states, and the stakeholders for the useful inputs and the political commitment, because we need it. So thank you very much. And in addition to what you mentioned, Ambassador, we have heard keywords: equity, community engagement, investment, not cost, funding, universal health coverage, R&D, One Health approach, public health needs, complementarity between local, regional, and international interventions, and political commitment. And as we prepare for the second high-level meeting on PPR, we must preserve this political commitment. It's very important, and that's key. And the political declaration should be ambitious, definitely, but it should also be practical and results-oriented. Above all, it should reaffirm our collective determination to translate the progress achieved over recent years into stronger capacities, stronger health systems, and greater equity for all. And I would like to thank the 2 co-facilitators for the political declaration, Anda and Armenia. Thank you for your work. And listening to you all, I was thinking that maybe the real test of multilateralism is not whether we can negotiate a new agreement, but whether we can finalize the negotiation of the PAPS Annex and implement the agreements we already have. And that is a challenge before us, I think. And it is our responsibility we have for the future generation, and we have to respond. Thank you.
Thank you very much for that, and I hope the member states that are in the room and can convey this message to their colleagues in Geneva, that maybe the test, as you say, Ambassador, is to complete the PAPS annex, bring that to a close, and then move on to implementation, because that's going to be very important. That has come through in a number of interventions. So this concludes the discussion of panel 1. And I really would like to thank our fantastic speakers for their invaluable insights. And thank you also for what you have shared, the perspectives that you have brought to the table, additional insights. That has been great. And it is clear from this discussion that equity must be at the heart of any effective response to pandemics. But equity does not happen by default. We must continue to work towards this principle, building core capacities, investing in systems and the people behind them, and strengthening collaboration and coordination across the PPPR continuum. These are critical priorities that we will carry forward into our discussion this afternoon in panel 2. So I would like to close the session, and we will reconvene again at 3 o'clock this afternoon. Thank you very much.